How do you fix a snub nose? A snub nose is often described as a nose that is shortened or upturned. This can be naturally the way that someone's nose is, but this can also be from trauma or from having surgery. You fix this with a rhinoplasty, where you use either your cartilage or cartilage that has been donated that's from a rib to lengthen the nose and create the tip dimensions and angles that is more aesthetically pleasing. How much does snub nose rhinoplasty cost? This depends on if it is a primary or the first time that you're having surgery, or a revision rhinoplasty. So the primary is less expensive. This can be $4,000 up to $10,000 to $15,000. In some cases more, depending on where you live. If it is a revision, this can be $8,000 to $10,000 up to $20,000, $25,000. Also, depending on where you live, what is being done, and what kind of anesthesia is being used. Is it normal for a nose to look upturned after rhinoplasty? This can happen. I wouldn't say it's exactly normal. It doesn't happen to everyone. This depends on the way that your body reacts to surgery. This depends on what was done during your surgery, what your nose looked like before and what it's going to look like after. But it's not uncommon for the nose to look a bit more upturned right after rhinoplasty, and even for a few months until the nose settles in and the swelling goes out and the nose becomes more close to the long-term outcome. What is a scarless rhinoplasty? This is an endonasal rhinoplasty, or a closed rhinoplasty, where you do not have the incision across the columella or in this middle part. Some surgeons prefer this. This is the way they do the majority of their rhinoplasties, so you don't have that small scar. Other surgeons, like me, prefer to do open rhinoplasty with a scar because it tends to heal very well. And with our techniques that we use now, you don't have that much difference in swelling. That was the argument 20 years ago, that you would swell more with the scar, but now it's about the same. The scar heals very, very well. I have one that you can't see anymore. And then also it gives me more control over the nose to get things exactly the way I want it to be. So I will use scarless rhinoplasty for certain situations, but for the majority of mine, I use open rhinoplasty. But there are surgeons that is the exact opposite. So pick a surgeon that you like their aesthetic and the way that their rhinoplasties look, and have that conversation with them if this is something that you're interested in. Have questions? Schedule a virtual consultation today at drangela.sturm.com. I would love to speak with you. Thanks for watching.